everyone. We are going to start the lecture now. Today is our first lecture from the 3 lectures we are going to give for the 3 consecutive days. These lectures are for our final preparation, which is for the ESR survey, which will be on 16th of this month. So this survey is a very important survey as far as this institution is concerned, because many things are linked together. And I hope that all of us are going to perform really good during this survey. I'm going to share this lecture in all the groups as well. And this now being recorded, so I will share the recording as well. So this lecture is about, first lecture is about ESR, a real survey journey. This lecture is going to cover a lot of standards today, inshallah. So we know that what are the ESR standards? These are the CBAHI, which is the Central Board of Accreditation for Healthcare Institutions, and that basic national requirements for patient safety in a list of 20 national hospital standards. These are distributed in 9 different groups. For example, we have HR5 for credential process, MS7 for privileging, PC25, PC26 for blood transfusion, VTE, LB for blood screening, QM17 for patient identification, surgical safety, anesthesia qualification, like these. So these are all the 20 standards that we are going to cover one by one. I will try to make it simple as possible. We will have a lot of other educational and training material, which will be posting in different groups. So the second lecture, which will be for the medication safety, MM5 and MM6, I think that these are mostly we are forgetting them, so we'll cover them also. Infection control, IPC4 and IPC15, Dr. Taha will arrange some online lectures for them. And FMS, because these are out of physicians and nursing part, so these lectures, I think these are more important for us to understand. So the first slide, this is about the survey day activities. Everyone during the survey has a role. Okay, during the day of the survey, the night before the survey, the day before the survey. So don't think that the people who are present on the day of the survey, although they are the front lines staff of our hospital, but you have the role a night before and a day before for the preparation purpose. Okay, so what's going to happen on the day of the survey? There will be a morning planning session. The surveyor will come to us, he will join us, and we will introduce our team to him, and we will assign the team. We'll assign the team for different aspects of that survey. There is going to be unit visits. There are 2 units visit. One unit, that's unit visit 1. It will include the radiology, lab, pharmacy, emergency, kitchen, and the service area. Then there will be a short break, and then there will be another unit visit, which will be in the operating room, ICU, inpatient, and stores. What are the different activities in all these units? I will explain to you now. Then there will be another break. There will be a document review session. In this document review session, there will be closed medical record review, personnel file review, and policy procedure and other document review. Finally, last 15 to 20 minutes, the surveyor is going to enter the data and give us a score. So then he will return back that what was our performance as well. So on the day of the survey, after the morning planning session, we will inform the surveyor that because he doesn't know about our structure of our hospital structure, so we will ask him to visit the stations as I have been here. So radiology, in the radiology department, what are the things that he's going to examine or survey? CNP, credential and privileging. So credential and privileging, CNP, it will be reviewed in every station. Okay, almost every station, credential and privileging will be reviewed. So make sure that in your desktop, credentials and privileging of that specific department and all the hospital is present. Okay, if it is not there, inform us, we will install there. There will be documents which will be reviewed in the radiology, like conscious sedation policy, radiation safety policy, TLD policy, gown, gloves, shield policy, QC policy. He is also going to examine for the shielding certificate and TLD reports. There can be short questions, staff interview from the radiology staff. Then we will ask the physician, the surveyor, to go to the lab, and there he can check the credential and privileging for the lab staff. Very important documents, Dr. Sabit: blood transfusion, blood donation, and TTD policy. He is going to check for your agreements and plan, and the forms. Many forms he can check, but most important are the in the closed medical record about the blood transfusion practices, the forms related to that, the screening forms. Okay, we'll ask him to go to the pharmacy. Then again in the pharmacy, credential and privileging for the pharmacy staff and the technicians. Very important documents. The officer or any pharmacist is here. You should know that pilot medication, medication use, LASA, hazardous medication, narcotic medication, all these policies should be there, present and prepared, up to date. And plans, pilot medication strategy, and hazardous material and waste management strategies. Plans, these will be reviewed inside the pharmacy. Meeting minutes of the pharmacy and therapeutic committee, and the RCA or any lists that are available there. We'll ask the physician, we'll ask the surveyor to go to the emergency department. One of the big area is emergency department. A lot of things will be assessed there. So first of all, the credential and privileging, of course, all ESR policy and procedures should be available inside the emergency department. Okay, so he can ask any physician any question related to any of the ESR standard. All the ESR plans, he can ask from any of the plans. But the most focused thing will be two areas: the isolation room and the conscious sedation area. Okay, isolation room, specifically he will go check the isolation practices, the triage area, how you manage the triage area, how you triage the patient, how you isolate the patient, where is the female and the male area inside the isolation room, what are the different forms and documents available. Conscious sedation area, the conscious, the bed, the airway, the crash cart, the medication list, the medications itself, anything he can check inside the conscious sedation area. Very important is crash cart. So the crash cart inside the emergency, any crash cart he can open and check for the documents and the will and the drugs. Then the fire safety, very important for emergencies, fire safety, whether proper fire hose, proper fire extinguishers, the guides to fire exits are available or not. Inside the kitchen he is going to focus on the fire safety. So fire safety plan and the fire safety documents should be available. The service area, which is our building department, he is going to visit for some very specific things like documents related to all the FMS documents and the no smoking policy. No smoking policy, he may ask in the closed session also. All FMS plans he can ask. Very important for the FMS department is to prepare and to have update reports. These reports include two things: the inspection and the PPM and the evidence. Okay. So this can be the civil defense, fire alarm, sprinkler system, clean agent, wet chemical, fire hose, and medical gas. So any reports he may ask. So these should be up-to-date reports available inside the service area. In the second unit, which is mostly the inpatients, is going to go for the OR. We'll ask the surveyor to start from one corner and go to the other side. So OR, again, credential and privileging for all the anesthesia staff should be available. Most important documents which should be available inside OR are the policies related to AN2, AN15, infection control policies, Dr. Ramzan, infection control, quality related policies, all the FMS policies should be there. Two important policies, patient acceptance and the OR traffic control should be there. Now you need to have OR schedules, okay? OR schedules mean your register for all the OR for at least for the last 3 months should be up to date. Okay, so please make sure that you have written properly this type of a surgery performed by this type of a surgeon, and this anesthetist was at that time. For example, For some critical cases, if you have not written the name of the consultant, anesthetist, or the specialist, we may reduce some score. Okay. And forms, all types of form. Most importantly, the consent, anesthesia consent, conscious sedation consents, all these consents should be there. Blood transfusion consent should be there. Your record of education and checklist should be inside the anesthesia department. And ICU, just like ER, ICU, many things will be observed inside the ICU. All the ESR standards, all the ESR plans should be available inside the ICU. He will stay there in ICU for more than half an hour. He's going to observe each and everything. So Dr. Jamal, Dr. Hatim, and all his team should be well prepared. There will be a staff interview as well. Okay. So he's going to look for some evidences like isolation practices, of course, each and everything related to the isolation room in ICU. The storage, he will go inside the store and check for that the storage capacity is well kept or no. Medical gas, of course, shut walls as well. He is going to look for each and every medication cabinet, especially the high alert medications. Fire safety and exit door. Exit door, of course, we do not have, but fire safety regulations and all practices should be there. Staff interview, there will be a good staff interview, so ICU staff should be well prepared. Inpatient, we will try to restrict him to only one department, maybe male medical or male surgical, okay, because these are more near to and well prepared all the time. So Dr. Hisham, Dr. Muntasir, all of our medical and surgical staff who will be on duty, you should know that credential and privileging are present. The credentials and privileges are present on the desktop. So also there is a website, our library, it's loaded there as well. Documents, all ESR documents. Where is the location of these one? Anyone he may ask from the physician or the nurses, so they will be able to produce all the plans. There will be an open medical record review inside the department, very important. Okay, so in this open medical record review, there will be a review of the QM 17 and 18. QM 17 is about patient identification. QM 18 is about surgical sites. I will go through one by one all these. Okay. PC 25 and 26, very important. And anesthesia 15, this is about conscious sedation. Medication charts and reports. There will be a staff interview. For sure, there will be a staff interview. So Dr. Hisham, Dr. Muntasir, Dr. Mahmood, all of you, please be ready. He will ask you questions related to the credential and privileging process. These PC, QM, these questions he is going to ask you. He is going to go for the store and the fire safety exit door. Maybe he will check for the isolation room inside the male medical ward as well. So I will cover a few of the standards today. HR5, which is actually the hospital has a process for proper credentialing of staff members licensed to provide a patient care. In personal file review, which is the last segment of our survey, you should know that it consists of two main aspects. Aspect number one is the training and other certificate. The training means that you have the credential and privileging, your degree and experience certificates, your data flow, and your Saudi Council for Healthcare Saudi Council certificate. In your other trainings, you need to have basic life support for all the physician, ACLS, ATLS, PALS, NRP, ALSO, whatever is applicable, and conscious sedation certificate wherever it is applicable. Other than these, in the personnel file review, he's going to ask about the job description and executive order if you have been assigned as a head nurse, head of the department, or any other executive position. In MS7, which is about the privileging process itself, which is medical staff member have current delineated medical clinical privileges. Again, there can be two parts. It can be a document review or the staff interview. In document review, he can ask during the unit survey, where is that privilege? Just show me the privilege of Dr. Ashraf, or just show me the privilege of Dr. Akbawi. So you should know where is the credential and privilege. Open the document. Akbawi is a surgical specialist. So it will be in surgery, inside surgery specialist. Inside that, there will be Dr. Akbawi privileges. Class open and show him these are the privileges and should be up to date. In open and closed medical record review, there will be a verification process and personal file review. Personnel file review, again, they can check about the privileging. And in the credential and privileging committee meeting minutes, Dr. Imam, very important for us. First meeting minute is credential and privileging meeting minutes. In the staff interview, of course, he will ask you about the privileging process. Okay, so this will be asked from whom? The head of the department, the consultants. This is an exclusive question that will be asked from the consultants. So what is the privileging process here? Three most important questions. What are these? What are the types of privileges? These are the temporary privileges, these are the emergency privileges, and the permanent privileges. Temporary privileges for 90 days, permanent privileges up to 3 years. Temporary emergency privileges which are granted during any emergency procedure up to 3 months. Okay. What are the roles and responsibilities? Very important here. Okay. So I will just quickly go through the privileging process. Whenever a new hire physician or nurse is there, okay, he will submit the credentials. As I said before, the credentials include your certificates, your experience and training certificates, and you apply for the privileging process. In the privileging process, you need to bring 3 main documents, which are the BLS, Saudi Council, and the data flow of your certificate. Then there will be a focused evaluation. Actually, it's a very quick focused evaluation in our hospital. Anyway, it is being done in the credential and privileging committee by Dr. Imam and the head of the department. So after that, the privileges are granted to that physician to practice. In the focused evaluation, a physician, surgeons mainly, they may ask for specific number of cases to be done before granting the privileges. For example, may ask 6 cases or 2 cases or 3 cases for specific type of a specialist. For example, a laparoscopic surgeon has came. So he will perform with the consultant so that the consultant will grant the privileges for that specific. Renewal after every 2 to 3 years, right, Dr. Imam? 3 years, huh? Okay. So renewal, at the renewal, mostly nothing will change. 2 years. Sorry, 2 years. So at the renewal, not most of the things will not change. But why I wrote renew, some of the physicians during their stay here, they will upgrade from specialist to a consultant. So at that time, again, the same process will happen. Okay. So you will apply for the new, you will provide new credentials and your new privileges will be granted. This is called as delineation. In PC 25, which is policy and procedures guide the handling, use and administration of blood and blood products. There can be, again, document review and the staff interview. Document, of course, we need the blood transfusion policy, which is under Dr. Deena, PC chapter holder. In very important, close medical record. Okay, so all the team who are going to review for the close medical record, please focus on all the forms which are related to blood transfusion. Blood transfusion like physician order, consent, request, screening, verification, blood monitoring, reaction notification, reaction report. Similarly, blood utilization committee meeting minutes. So these should be up to date. In the staff interview, again, during the unit visits, the surveyor may ask any of the physician who is responsible to take the consent. How you will request, you will write down in the physician order and you will take the consent for the physician are responsible for both these processes. Then he will prepare the blood request form. The nurses, they will bring the blood, they will verify it, and they will start the transfusion. So the 3 main important roles that you should know: who is responsible for the consent, for the order, who is responsible for the verification, and what is your role and responsibility during a blood transfusion reaction. The questionnaire I will upload, so you will be able to read as well. I will just quickly go through the process of blood transfusion reaction. What you do, whenever there's a blood transfusion reaction, you stop the transfusion, you prime the cannula with saline, you inform the physician, start the treatment according to the condition, inform the blood bank, send samples, and document whatever you have done. So this is about the blood transfusion reaction. PC 26 will be inshallah relatively easy, which is about the patient at risk of developing venous thromboembolism are identified and managed. So there will be an open medical record review. It's an open medical record. Okay, they will open the file. Patient assessment, patient reassessment. VTE committee meeting minutes. Okay, Dr. Imam. So very important, VTE committee meeting minutes should be there. Policy and procedure, consent form, very important. This NAT consent was supposed to be in the other one. Sorry. And all the forms related to that. In the staff interview, he may ask you about your VTE practices in the hospital. So what you do during the VTE assessment, you do the initial assessment, perform the screening, and provide the appropriate prophylaxis, and you register in the HIS. Then you do the daily reassessment. If the score remains same, then you do the reassessment during the time of the discharge, provide the prophylaxis, how much time he's going to take it, give him some education and follow up. But if the score will change, you do a new assessment, do a screening, and give the proper prophylaxis and update in the HIS, and then again repeat at the time of discharge. In AN2, which will be observed inside the OR, we have three main things. Personnel file review, which will be about the credential and privileging of the anesthesia consultant, their training certificate. Document review, mainly for the conscious sedation policy. It should be available in the document review session as a closed document session inside the conscious sedation area, and should be a soft copy with the anesthesia department as well. Forms related to conscious sedation, consent, medication list, monitoring form, discharge criteria, discharge instruction should be available in all conscious sedation areas. Also, all the physicians who are giving conscious sedation should have their certificate in their personal file, and a rota of physicians who are providing the consultation. In the area inspection, Dr. Imam, Dr. Mazin, please remember that they will observe for the airway trolley, medication trolley, oxygen suction, pulse oximeter, blood pressure, ECG monitor, and the crash cart. So these should be very well prepared. In QM17, as you all know, this is about the identification process. The hospital has a process of correct identification of patient. So three things: document review, staff interview, and observation. Mainly, it is nursing interview. So he's going to ask about patient identification policy in closed session, maybe. Open and closed medical record review. Each and every form, it has the patient identifier. What are the identifier? These are the three names of the patient and the MRN, okay, medical record number. We have the electronic file, so inshallah it is already available. But some forms which are still the hard copy, make sure that the patient identifiers are available. Wristband, of course, this will be specifically in two areas, in ICU and inside the ER. Okay, so they will observe for the wristband if they're going to check the patient. Okay, but ER, of course, they will check for the wristband. So all the patients inside the ER on the specific day, all the patients inside the hospital should have the wristband on the specific day. QM18 is about the process. The hospital has a process to prevent wrong patient, wrong site, wrong surgery and procedure. So this will be questions from asked from the surgeons. Okay. There are two things, again, document review and the staff interview. So Dr. Isham and all his team should focus on the policy for the correct size, correct site, surgery, and correct procedure. You should know about the preoperative checklist. You should know about the list of invasive and non-invasive procedures, surgical site safety checklist, which is mainly done by the nursing staff. Patient two policies, which should be available inside the male surgical, female surgical, and in the OR is patient acceptance to OR and the OR flowchart. Okay, this will be observed inside the open medical record. Okay, Dr. Isham, make sure that your open medical record is well prepared. Okay, so they will check in the open medical record. In closed medical record, what's going to happen? When he will go to the OR, he will select few files for closed medical record. In closed medical record, he's going to observe for only specific cases, okay, like pediatric cases, neurosurgical cases, plastic surgery cases. He will not check most of the surgeries, okay? But in open medical record, he can check any of the surgical document, okay? In staff interview, again, for the surgical team, surgical site marking, who is responsible to mark the site, what type of marker you use, what is the sign you are using, it is SF. If patient is allergic to, what you will do, if the size is small, what you will do, if the patient has burn, what you will do, where do you document it, all these type of questions will be asked. And these are very easy questions, and we have already uploaded a video about it. Preoperative checklist and surgical safety practices. A very important questions that can be asked at any place, wherever the procedure is performed, any procedure performed anywhere. It is not necessarily that it will be asked in the OR. It can be asked inside the emergency department conscious sedation area. Three questions. What is sign in? What is time out? What is sign out? Sign in is before induction of anesthesia. What you do introduce yourself, each other, the teams, the surgical team, the nursing team, and the anesthetist team. They introduce themselves. Okay, they introduce what procedure is going to perform, and they identify the correct patient and the correct surgery and the correct site of the surgery. Okay, so also you check if the patient is allergic to something or there is an anesthetist. I will upload this, Dr. Ramzan. And also if the patient is going to have any complications. In timeout, which is just when the patient has already been given anesthesia, so there will be a pause. This is announced by the surgeon himself. Okay, the surgeon will introduce himself, and all the team, they will define their roles. Mainly it is in the bigger hospitals where every day there's a new surgeon, every day there's a new anesthetist, no one knows each other, so they introduce each other. But here, again, the surgeon, they will start with this timeout. I am Dr. Abdul Waheed. I am the chief surgeon here. I am going to perform this procedure and I need these equipments. Okay, this complication may happen. So everyone should be ready. Surgeon, anesthetist, I am the anesthetist. I am the nurse for the scrub. I am the nurse for the sporting nurse. Okay. So again, patient procedure and the site of position equipment, and in any case, any critical events are. Sign out, it is the time, again, a pause just before the dressing, or you can say before closure of the wound. So what you do, mainly the role of the circulating nurse will come here. She will check for the sponge, the gauze pieces, the sponge and the gauze pieces and the cottons which are used during the procedure. Okay, she will do the count, which is the most important thing. Unless she will complete the count, do not close the wound, do not remove from anesthesia. Again, you review the procedure, count, surgical site labeling, and you plan for recovery. Okay, that this patient is going to recovery, may need oxygen or warmer or something. So this is all about our ESR survey. We will be uploading a lot of education and training material. All the staff, they have responsibilities. Okay, during the day, before one night, they have a responsibility for preparation. All of you are our frontline staff. All of you should prepare yourself. Okay, there will be question and answer that all of you should know. Okay, from tomorrow and day after tomorrow, there will be mock round. Anyone, anywhere, all of the leadership may start asking you these questions. So you should be well prepared about it. If you need any of the training and education material, this will be uploaded in the library. Also, it will be available in different WhatsApp groups. Okay. So from my side, wish you all of you a very best of luck. This is our survey, and inshallah we are going to pass. Thank you very much.